to OptiSmile teledentistry interface. So this is the American Dental Association website, which OptiSmile is following guidance. As you can see, it's very up to date. So I've downloaded some of these flowcharts so that current patients of OptiSmile can understand where we're at with the coronavirus during the shutdown, as well as internationally accepted guidelines. So you can see the whole screen. What I will do is just take my picture away from the top here, and I'll come back to you in a minute. So just see if I can get rid of that. Okay, so I'm going to pull up a flow chart so that people can understand what is going on, what dentists should be following in terms of guidelines for treating patients. So with the coronavirus, it's actually spread through saliva droplets as well as other kind of mucus from your nose and your mouth. And so coming to the dentist and getting a filling done where you use a drill is really not recommended. So this is up to date as of yesterday, and it's basically a flow chart that dentists around the world should be following. It's obviously up to the individual dentist and the individual country. Since I practiced in America for 16 years and in Australia for 12 years, and while there's no clear guidance from the South African Dental Association, I like to play it safe, and this is what we'll be following at OptiSmile. I will upload this on the web page if you want to look at it more carefully, but we've created some forms that basically take you through this process. And so the number one thing is you can only have emergency or urgent dental care. And so the first question is, are you experiencing dental pain? Obviously, a cleaning or a checkup or whitening will be out. So if we go here to no, because it's easier, if you don't have pain and the answer is no, then it asks, do you have uncontrolled bleeding? So obviously, if you have uncontrolled bleeding, then it's an emergency. So uncontrolled bleeding, it's an emergency. You would go straight to the emergency room, okay? And then, do you need any of the following? Suture removal, denture repair, are you going to have radiotherapy? Have you got cancer? Do you need a biopsy? Or have you lost a temporary? So if the answer is no, then it's routine and non-urgent. And then if the answer is yes, then we have to screen you to see whether you may be potentially infectious. So that was pretty easy. Let's just go back here to the other one where, yes, you are experiencing dental pain. So have you had dental trauma? Have you had an accident, or have you had an injury, maybe a car accident or some kind of trauma? So if there's trauma involving the facial bones, then and your airway is obstructed, obviously you need to go straight to the emergency room. If it's dental trauma only, then we go right down to the bottom, and there is a whole lot of stuff, different things that can happen with regards to dental trauma. So that's not a cavity, that's dental trauma, and that's considered urgent, but it's not an emergency. So under urgent, there are things that can be done, but only in certain circumstances. So we will be using a video call to help go through this with you. And then the answer is, if it's no, if you haven't experienced dental trauma, then the next question is, do you have a fever and swelling inside your face or mouth? If the answer is no, then you go to this, what is your pain level on a scale of 1 to 10? We'll come back to that in a second. If the answer is yes, and you've got pain or swelling and a fever, you go straight to the emergency room. If your pain level is on a scale of 1 to 10, if it's a 1 to 5, mild to moderate, then the question is, can the pain or discomfort be tolerated or managed at home for 2 or 3 weeks? This is something that we'll go over with you on the video call. So we are, for our patients, offering a no-charge 15-minute video call with myself, and we have a scheduling system for that. So if it can be tolerated, then you should delay scheduling an appointment until further notice, in accordance with the local and the state guidance, and to contact us back if it does get worse. If the answer is no, then one has to go through to that bottom chart, which is where only certain things can be treated as an emergency. Then if we go back to if you are having severe or intolerable pain, are you having trouble swallowing, do you have trouble opening your mouth, then those are things that are considered urgent. So what we'll do is get out of this screen and take you to a second chart, which is the emergent, the questions and answers regarding whether you can actually be seen as an emergency, which is this algorithm 2.
Use the algorithm 2.